Hi, my name is Jareen Bautista. I am a singer and a theater actress, and 5 months ago I was here. I got a nose touch-up. So what happened was I got a non-surgical nose procedure done. It did not take much time. It happened for like under 10 minutes. And today I'm gonna have my chin enhancement done. So Doctora was talking about this thing called ratio and proportion. There's gonna be a chin enhancement. They're gonna protrude it a little bit, and the nose will there will also be a touch-up on the nose just to even things out. And I'm not really sure what's gonna happen. I also don't know what it's gonna look like, but I trust Doctora Contessa by now. She's been doing my face for so long, and I know it's gonna be beautiful. Don't forget to like, subscribe, and hit the bell.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome Miss Jareen Bautista.
Hello po. I'm so really happy to be back.
We're glad you're here with us. So if we kind of review the treatments that we've done for Jareen, like how many years ago during our first treatment for non-surgical nose enhancement?
Probably 3 years ago.
Yeah. So that was 3 years ago.
Yeah.
And then after 1 year, we did another one.
Touch-up.
And then 6 months ago,
another touch-up. All these are very subtle touch-ups.
Very subtle, exactly. We just wanted more of a natural enhancement. So this is our fourth one.
Yeah.
Okay, so we're checking on her nose. Well, I could still say that the height of the bridge and the tip as well, they still have that good projection. So far, what were the reactions of your friends, of course your family? What did they say?
This is the best thing I like about it. They barely notice, but it's there. Once you point it out, they could see, and they could see the improvement. But it's not like they see me on the street and not recognize who I am because it's a different nose. It's still my nose, but then a little more enhanced, a little more contoured.
Correct. Probably if we look at your photo 3 years ago before doing the non-surgical nose enhancement, we can see like an improvement there, like a change, right?
Yeah.
So for today also, of course, we will again do your touch-up for the nose, just a little bit. Now, what I notice right now is on the lower part of the face, the chin area. So I was checking on Jareen's, like the chin side view. So we have this so-called Ricketts E-line. So when you check on this, for example, profile, so lateral view, then you measure tip of the nose, then lower lip, and the chin, we notice like there's a gap. There you go. So we have this, of course, in aesthetic medicine, we follow ratios and proportions, we follow measurements, we follow lines. Okay, so when we did like an assessment on the so-called Ricketts E-line, the chin is kind of receded. So we just wanted to balance it. We're still within the proportions. It's not altering your looks again. Still Jareen, improving more, enhancing naturally. And then I noticed when I was talking to Jareen, she was doing her facial expressions. I'm seeing some dynamic line on the glabella area in between the eyebrows. So you're already in what age? Early 20s?
25.
25! Okay, I've been mentioning aging starts at 25. So if you see something like that, do something about it. Okay, prevent already the formation of the so-called static wrinkle. So we want to work on this, the glabella, the nose, the chin. So you notice it's in the center vertical fifth, the rule of fifths for the face. So what kind of treatment, what procedure, we'll show you when we return. And we're back, so we're with Joreen and we are working on the so-called, the center of this vertical fifth of our face. So from glabella, nose to the chin. So it's more of the profile view of the face or the lateral view of the face. Now I'll start working on the nose area. So we already have done previous non-surgical nose enhancement for Joreen. So this is the fourth, right, Joreen?
Yeah.
So like there was an interval, the initial one, interval of like a year. Then there was like a 1 year that we were not able to do something. Because I think you were abroad, right?
Yeah.
So 6 months ago, we did one, a natural again, like few of our PDO threads. Now we'll be boosting our non-surgical nose thread lift. So I'll make a so-called like applying or rather like an injection of our lidocaine solution to numb the entry point. So this is our entry point again here. So we'll just inject a little bit of that. Now for my patients whom I do a repeat nose thread lift, I do a so-called hydrodissection technique because we expect already a so-called tissue fibrosis. So this is like a tumescent solution and I'm using a cannula gauge 22 here, and I do an antegrade or anterograde infusion of the lidocaine already. So to numb the area, I use this tumescent solution. And I also have my cannula gauge 22 to place it in the layer 4. So kind of like you're creating again that tissue space for the placement of our PDO threads or the thread reinsertion. Okay, so I do this hydrodissection because, you know, repeat nose thread lift, you will expect tissue resistance already because there is the so-called tissue fibrosis. So I'll use my Wyco PDO threads here. It's 60mm length cannula, though the thread inside is a it's an 80mm length because it's folded. So you have a thread inside and a thread outside. So the thread is 80mm length. So again, these are absorbable type of threads and they stimulate collagen formation. Okay. So I wanted to improve also the glabella part. So I have improved the length of the thread. Previously we were using like cannula 50mm. Right now it's 60mm to also get rid of the so-called glabellar line there. Okay. So we'll be using about what one? We can modify now. We can use a 40mm. So this is a fourth one. So for those doing repeat nose thread lift, you can use less number of your PDO threads for the re-enhancement. Okay. So this is a 40mm. So I do combination right now to still create that feminine slope of the nose. Okay. Now we'll work on our tip columella. Okay. So we're done on the bridge. Now we'll proceed with the so-called tip columella. So I'm using the same entry point, and again I have my tumescent solution here, and we'll just glide it into the space here, the so-called intercrural space. Okay. So this one we need to make our entry point wider here. So we're just gonna do that and use my gauge 22 cannula to insert into the space, the so-called intercrural space. So I need to reach the base, the so-called anterior nasal spine. So the sensation is like having a dental anesthesia here. So I'll use my 40mm length Wyco thread here. So this is the so-called Wyco. I'll pinch your columella and insert it in that tissue space. So I'll be using just 2 pieces here. There you go. And another one. So now we have done the booster nose thread lift. We'll proceed with the chin enhancement. Now for Joreen, since we always wanted like a subtle improvement, okay, before doing the injection on the chin, let's do some so-called measurement. So Ricketts A-line is from the tip of the nose to the lower lip, and you will notice a gap. Okay, so we need to reach this line here to improve the chin profile. Okay, so we have done the measurement. So I'll be using hyaluronic filler to improve that chin. So you notice that our chin is kind of receded. So we just wanted to do a so-called chin projection. Another measurement that we do, by the way, is the length. So when it comes to the length, so we have this ratio called 1:2. So subnasale to that middle part of the lip, and then you check on the length here. So if this is an inch, so ideally we need 2 inches here. So there's also kind of like a deficiency in terms of the vertical dimension or the length of the chin. So we'll just use a 1 syringe of our hyaluronic filler, so it's still gonna be subtle. So for Joreen, we're doing like little by little, so we don't want a very drastic change, right Joreen?
Yes.
Okay, so I'll be working on the chin part. So for female chin, as compared to men would want square chin. So female chin is a round shape chin. So or if you draw like an inverted triangle, so like from the temple region to the cheek to the chin part there, something like we call, or a V contour. So this one is kinda, well, we don't want that too much of a pointy chin, okay? We just want it to still have that kind of round shape bit thing, but projected, okay? So I'll be injecting into the so-called chin apex. Disinfect, please. So a while ago, we applied topical numbing cream, your lidocaine. And then we left it for about, like, you can leave it 30 minutes to 45 minutes, depending on the concentration of your lidocaine. So I'm just gonna be working on the chin. So reach the bone, so it's already the mentalis bone. Okay, I'm just gonna do an aspiration there and push our product here. So for my chin apex, I usually start with a 0.5 there, depending on the needed length. So we still do an assessment or measurement, so it will depend on that needed elongation. So once we've done the chin apex, I'll still do a so-called kind of like a bilateral injection here for anterior projection. So a while ago was more of the improvement of the vertical dimension. Right now it's improvement of the so-called anterior projection. So I can give like 0.25 for one side and another 0.25 for this side here. So this is for the chin part. Then my final treatment will be the easiest one, is the so-called Glabella botox. Okay, so I still have a 0.1 there, and just checking on the deficiency here. There's a deficiency there, so make sure that the shape is balanced and within the proportions of the face. Okay, so harmonizing the results. So there's a so-called face harmony. So just pressure here. So my final procedure will be this relaxation of the so-called glabellar complex, your procerus and your corrugator muscles. So I'm using a botulinum toxin. So I'll relax your procerus muscle here. So I can use 4 units rather. And then here like a 2 unit here and a 2 unit there. And then the tail of the corrugator, a unit, and a unit here. I still have a remaining one for this. So we've done procedures, 3 kinds of procedures. So your non-surgical nose enhancement, chin enhancement, as well as your glabella botox. We'll show the result to Joreen when we return. We're back. Let's show the result to Miss Joreen. There's our mirror.
Ooh,
so everything again
so
is
natural.
Yes, in like in moderation.
Yeah.
Okay. So we still have some pinpoint bleed for the nose tip.
So it's really It is natural. It's just because it's newly injected. I remember that it doesn't integrate yet. But then in a few days, I remember if it's like this, it
will
actually
still kind of soften and it will blend well with the tissues inside, right? Because a while ago, I also did hydrodissection on the bridge of the nose. So you notice it's a little bit like swollen, but you know, after a few days, it's gonna be, you know, softer looking and still it will subside.
Yeah.
Right? So in summary, again, we did the non-surgical nose thread lifting, a repeat nose thread lift, and then we did some minimal chin enhancement and also like a relaxation of the glabellar muscles with our botulinum toxin, because I was already noticing a dynamic wrinkle in the center part of between the eyebrows, right? So far, how was the like injection experience?
Okay, so for the nose, the worst part really is the anticipation, because it looks worse than it actually feels. How it feels is more like pinching pressures. That's what you feel. For the chin and the what do you call this again?
This part between the eyebrows.
So for the chin and between the eyebrows, for the forehead, it's really just a very, very tiny pinch. So that's how it feels. It's relatively comfortable if we're speaking pain.
Right. So it's normal to feel some heaviness in some areas, especially the chin, because when I had my chin filler also feels like heavy or some pressure like that. Okay, but so far, no pain for me, okay? Depends on some people, okay? So we've done these procedures and you'll notice like it's instant, this nose thread lift plus the chin enhancement, you'll see instant result. And then of course with the botulinum toxin, you give it time. The onset of action is third day, day 3. And then it works up to day 15. Okay, that's why we tell them to come back after 2 weeks so we can check on the outcome, on the effect of the treatment that we have done. Thank you, Joreen.
Thank you so much. I'm really happy.
Right. We still were able to maintain her Asian look, because she needs to be more Asian, right? Because you're into like a stage.
I do theater. I don't want to change.
Yeah, right. Especially your role is more of the Asian. Asian face, Asian role, right? You might be looking a little bit Caucasian. Right. Thank you so much, Joreen.
Thank you so much for having me.
And we're so happy, we're proud with all your achievements. So recently you were in a like stage play.
I did I did a Frozen in concert.
Yeah. Disney.
So I was playing Princess
Is there a
Anna.
repeat?
No, not yet.
Next year.
Maybe.
Yeah.
Let's see.
Hopefully we can watch. Let's watch her. Okay?
Yeah.
So is it okay that if they have questions about what you've done, some people might like drop some questions and then you can just forward it to us.
Sure.
Like most of the time they ask, is it painful? There you go.
Sure.
Yeah, so they can reach you at Instagram.
Joreen Bautista on Instagram and at Joreen B on TikTok.
Okay, so we will follow you.
Thank you so much.
If you have any questions, you may also reach us at our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics, email address, csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9190 or 0917-504-4268. And please do watch our other videos. We had Joreen in previous like 4 episodes, something like that. So just like type the Contessa Salvador at the YouTube. Yeah, our YouTube channel, Contessa Salvador. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.